First of all, knowledge is compliance. Knowledge is success. So therefore, we have to educate the patient before surgery about the pathophysiology, the change of anatomy that they're going to undergo with their surgery. That is very important. Their nutritional demands, how that will change. Not just fats, carbs, proteins, and caloric intake, but the times of day they're taking in their calories, the texture of their food. Next is, once they understand the surgery completely, then we offer the surgical procedure. Either they leave the same day or they stay as an inpatient. Whatever surgery they receive has a different hospital stay. After that hospital stay, we'll see the patient post-operatively, and the patient will be seen by my dietitian as well as one of the surgeons. And we'll just make sure that the patient's surgically stable and make sure that they're attaining their nutritional goals. Next is they have to go over the program. At this time, they either start getting their band fills, or if they're a bariatric or if they're a gastric bypass patient, they will just follow up with the nutritionist and get the appropriate post-op labs. But it's not only that, then it goes to exercise physiology. So it's the entire umbrella is surgical weight loss with the aid of diet, exercise, and behavior modification, and really educate the patient. We also offer monthly support groups where the patient can either go online and we webcast these support groups, or they could actually come to the support group. The support group is run by our psychologist, exercise physiologist, and bariatric nutritionalist. And the psychologist will also see the patient in this multidisciplinary approach, not only pre-op to screen the patient out in a psychological sense, but also to offer realistic goals and expectations. What are you doing now? This is what we expect you to do, and this is what your expected outcome should and could be. And is it realistic to the patient? What are the external influences on the patient, which is also integral for success, because we also understand that not only is the patient undergoing this surgery, not only are they undergoing this lifestyle change, but this is going to influence all those around them. And we really try to encompass not only, again, the patient, but all their significant others, and encourage them to bring them to their office visits or to the support groups. For each band fill, the patient will come in, and they're going to see the dietitian. They're going to go over calorie counts. They're going to go over what they're eating and when they're eating it. And then we're going to see if their weight loss is optimized. If their weight loss is not optimized, is it a surgical issue? Is it a psychological issue? Is it an exercise issue? Or is it a dietary issue? And we fine-tune that, and that's the department that we send them to, and that's what concentrates on them. Usually it's a little bit of both, or a little bit, it encompasses all those modalities. So that's kind of how our program differs. And in using the surgery as a tool and not the end-all be-all, it allows for a greater percentage of excess weight loss of what we've seen with our patients.